Okay, I'm going to discuss the writing assessment criteria with you. These specifics are important to understand your strengths and weaknesses when you're writing your letter. So the OET assessment criteria has 5 parameters, and all of them have 20% of the weightage to the total score. They're marked from 0 to 6. So that means that you've given marks out of 0 to 6 for each of these criteria, and then an average is taken out, and based on that you're given an overall score for the writing subtest. We're going to discuss each one in detail. We'll start with the overall task fulfillment. Overall task fulfillment has these sub-criteria. First one is having the right amount of word count. So the OET Center suggests that your letter should be between 180 to 200 words. And by 180 to 200 words, this refers only to the body of the letter. It does not include the layout. It does not include the time, the date, the address, the subject line, or the signing off. It just includes the body of the letter. Now, I think this is one aspect which is commonly misunderstood by many students. So I'd like to point out that the OET Center designs the test in such a way that your relevant material would have exactly the amount of content for 180 to 200 words. So if you have selected the right criteria, depending on the recipient, if your selection of case notes is relevant for the recipient, then your letter would be between 180 to 200 words. If it's a bit on the outside of this range, that means if it's a little less than 180 or if it's a little more than 200, that's fine, because there are different styles of writing and adjustments can be made by OET assessors as long as the relevant information has been included in the body of the letter. Then use your own words rather than copying from the case notes. Essentially what this means is that rather than copying phrases or words from the case notes, you should try and paraphrase and use synonyms wherever necessary in the body of the letter. But then this is something, again, which can be misconstrued and it can be misunderstood. So I'm not implying that you have to use every word differently. There might be some words, for example, rather than writing rigorous, if it's mentioned in the case notes that the patient has to avoid rigorous activities, you can use a synonym. You can use something like strenuous or laborious or physically challenging or physically demanding. So that will demonstrate a vocabulary range at your disposal. But you also need to realize that the case notes are designed in a way in which notes are prepared by nurses for other health professionals working in the hospital. So you will need to make adjustments while writing your letter. For example, if a shortened form has been used in the case notes, for example, if you see TEMP written, that stands for temporary, or IMP for important, so you will need to use a complete word. Don't write the shortened form as it's written on the case notes, because the case notes are prepared for other health professionals to read with an understanding that they will interpret the meaning when they read it. But now you're writing to a different audience, and depending on the recipient that you're writing to, you will have to adjust the language that you use. So try and avoid copying words or phrases from the case notes. Use your own vocabulary wherever possible. Obviously, you will not be able to find synonyms for medical conditions or medical terminology, so you can use that as it is, but other than that, try to paraphrase the information. The next one is avoid formulaic response. This means no templates, no frameworks. I know that a common tendency that students have is to follow a certain framework or a formula, and the most commonly used formula by students is writing the introduction followed by social and medical history, and the next paragraph is about during hospitalization, and then the requests, and then the closing. And while this can fit certain contexts, but it can only be used for a specified number of case notes and tasks. It might not work in every case, and this is something that you need to keep in mind when you're preparing for the exam. If you're training yourself to write and approach each and every task or case notes with a certain formula in mind, with a certain template in mind, it can lead to disappointing scores. And I would strongly advise against this approach, because if you're wasting time learning a formula which might not work according to the case notes in the exam, it will do more damage than gain intended. So that preparation time in which you're training yourself to follow this formula can be put to better use, and try to learn different ways of structuring your letters to approach each task with a different mindset, that this formula or template that I have learned might not work in this case. So I'm strongly advising all students to get rid of any templates or formula frameworks that they're relying on. Then the fourth one is only include relevant information. So like I pointed out earlier, the OET Center designs the test in a way that they would include that much information which can be written in 180 to 200 words, and only that much would be relevant for the recipient. And there would be distractors to confuse you. And while it would be a convenient approach to include everything that seems important to you. For example, there would be aspects like medical history and social history, which would seem very compelling and you would want to write it in your letter, but then you need to see whether the recipient, whether the audience that you're writing to, they would find it significant, or whether it's related to the task or the context or the requests that you're making through your letter. So this is overall task fulfillment. Next is appropriateness of language. So the first sub-criteria in this is organize the letter clearly with the most important information first. And this is again a reflective of the third criteria, comprehension of stimulus. So you'll see that some parameters overlap, and if you don't demonstrate an understanding of the case notes and the writing task and the context, it's going to make you score poorly on different parameters, not just one. So in appropriateness of language, the first thing that assessors want to see is whether you have organized the letter clearly with the most important information first. That means you've got to highlight the main purpose of writing the letter in the very first paragraph. And I've seen many letters in which students tend to again follow a format. They've memorized a way of writing which goes something like this. I'm writing to refer this patient for ongoing management who presented to us in this state and is going to be discharged today. And while this may work in some of the cases, it's not going to be relevant for every task or letter that you get. So the introduction would vary depending on the recipient. It would vary depending on the case notes or the scenario or the context that you give in. For example, when you're writing to a social worker, the timelines are not important. So the date of admission in that case, it's not very significant. As opposed to an example, when you're writing to rehabilitation center or a doctor, in those cases, the timelines are quite important. So the example that I just discussed, that would work, but provided that you highlight the type of care required. So when it comes to the kind of cares that are given, the kind of treatments, there are specialized treatments which we have to request at times. It can be follow-up care, it can be palliative care, it can be a second opinion, it can be an assessment, and it would all determine how your first paragraph is composed. So be clear about the level of urgency. That's the third point. This means that when you see the case notes, see whether a situation is urgent or not. And by urgency, I mean whether the patient's condition is critical, is it stable or is it unstable? For example, we have this letter for Betty Olson in which a patient is unconscious and she has been transferred to the hospital via an ambulance. Now, in this case, if you use a template where you want to write the medical history first, you would score poorly on assessment criteria for this kind of response. If the situation is urgent, which means that it's a life-threatening condition, or your patient is unconscious and the patient's condition is unstable, or it's life-limiting, the condition, then you need to make adjustments to the structure of your letter. Then you would start by outlining what the most important information is. You need to prioritize that this patient is unconscious and then give details of what happened in the recent past about that event when the patient lost consciousness, and so on. So I'm not saying that it's important for every case, but if a situation is urgent or not will largely determine how your letter is organized and structured. Then the fourth one is use the reason for writing to inform choice of register and content. Register means the discourse, your style of writing. This is what it means. And in other words, this point means that depending on the recipient you're writing to, your vocabulary, your style of writing, the information that you include and how it has to be arranged in different paragraphs, this will vary. So if you're writing to a social worker or a family member, you would not be using any medical terminology or any medical words. You will use lay language. But when you're writing to a doctor or a health professional, you can use medical abbreviations with an assumption of understanding that they will be able to gauge the meaning, or they'll be able to understand what this abbreviation or what this acronym means. Prioritize the most important information first. This is again a reiteration of what I discussed in the second point, that highlight the most important information first. Depending on the level of the urgency that's there in front of you according to the case notes, plan a draft accordingly. Use dates, times, topic sentences, or other organizing features. And this includes dates, that is admission dates, or dates of various consultations when the patient presented to you during subsequent visits. Times, it refers to the timeline. For example, if you're referring patient for a second opinion, you would want the doctor to know the timeline of when the patient first presented to you and how the symptoms have been developing over a period of time. So timelines become important. And topic sentences or other organizing features means about signposting language. So you can use adverbs of time to convey time relationships. You can use words like following, subsequently, next, then, to demonstrate an understanding of your understanding of drawing an inference of the time relationships in a healthcare environment. Then this concludes with the second point, which is appropriateness of language. Then is the third one, that's comprehension of stimulus. The first point is demonstrate full understanding of the case notes, and this is something which is reflective of the previous criteria. So the previous criteria outlined the importance of organizing the letter clearly with the most important information being written first. So comprehension of stimulus again reinforces this. You have to demonstrate understanding of the case notes by picking out the main issue and picking out what's the presenting issue, what's the primary information, highlight that first, and then move on to other secondary information. Make the main issue clear to the reader. This again means the same thing depending on the level of the urgency or depending on your understanding of what the main issue is. What kind of request are you making to the recipient? Write that first, provide enough background information for completing that request, and then you can provide other secondary details. Then make clear connections between different case notes for the reader. This means that you have to demonstrate understanding by connecting different parts of case notes together and show an understanding that you're able to draw an inference, you're able to interpret the significance of reading a medical document and arriving at a conclusion. For example, if in your case notes, let's say in the medical history, a prescription is given of a medication with a certain dosage, and then during hospitalization, the dosage had to be increased or decreased depending on the patient's condition. And then in the discharge plan, it has been advised that the prescription might have to be renewed by the GP. So rather than writing it in different paragraphs, try and make one paragraph and describe whatever happened with regards to adjustment in the dosage of that medication. So that's why I'll again like to point out that using a template or memorizing a format in OET writing would not work because if you do that, you might not be able to score high on other criteria. For example, in comprehension of stimulus, if you're not making connections between different parts of case notes, and those parts being medical history, social history, and then nursing management, and then discharge plan. If you're not able to make connections between relevant or thematically related pieces of information, it would become hard for you to score high on this criteria. Then there is clearly posed questions to make requests of the reader if necessary. Now, this means that you need to outline the requests clearly, and I'd like to advise against using question marks in the letter. In formal writing or in medically written letters, there are no question marks. If a request has to be made, I think it's more suitable and appropriate to write, "It would be greatly appreciated." That's better rather than writing something like, could you please do this, and then ending it with a question mark. So I would advise using sentences that start with could and then they end with a question mark. It's better if you write it like this, that the patient should be encouraged to do this, the patient needs to do this, you are requested to do this, it would be greatly appreciated if you do this. So make your requests in this language. It's more direct rather than posing a question. So don't use any question marks in the letter. Then the fourth one is linguistic features, which deals with grammar and cohesion. Now, use language accurately and flexibly, and language accurately means there shouldn't be any mistakes. But then again, there's something that I want to point out here. It has to fit the context. Whether you use a grammar feature accurately is not just enough to score high on this criteria. It should fit the context. For example, if you write something in past tense and it has been used correctly, but if it doesn't fit the context of the case notes, you're using the wrong tense to express an action that's ongoing now, you're using a past tense, then despite having used correct grammar feature, you wouldn't be able to score high on the exam. Use a combination of complex and simple sentences appropriately. I haven't mentioned compound sentences here. You can add that as well. So the OET Center wants to see a range of grammar. If you're just relying on making simple sentences to avoid any mistakes, that doesn't necessarily mean that you will score a high grade like A or B. So you need to demonstrate a range of grammatical features, and for that you need to be able to use complex sentences, compound sentences. I'm not suggesting that every sentence has to be a complex or compound sentence. Use a variety of simple sentences as well, but wherever possible, try to use complex grammar. Add a little complexity to your writing. Use connecting words and phrases effectively. This refers to discourse markers, and I'm sure you're getting enough training already about discourse markers and connecting words like conjunctions and relative pronouns, relative clauses, which include restrictive and non-restrictive clauses, and conjunctive adverbs, and so on. No set limit of grammatical errors allowed. And I've mentioned this point here because I get a lot of questions from students asking me, is there a maximum number of mistakes after which we wouldn't be able to score B grade? Now, I'm not sure which website suggests this, but there is no set number of mistakes. It's more to do with the kind of mistake that you're making. For example, you might make 5 mistakes, but if they're minor and they don't impact communication, that's fine. So it's possible to make 5 minor mistakes and then yet again score a B grade. But if you've made one major mistake that leads to loss of communication and can create a big misunderstanding for the patient and impact their care, then yes, that's a big problem. And the fifth one is presentation features. The first is use punctuation correctly, and punctuation doesn't just mean full stops or commas. It includes semicolons, apostrophe. You can use quotes as well if you're trying to report something that has been verbalized by the patient exactly. You can use quotes which look like this. So when something is enclosed between these inverted commas, this means that this is exactly as said by the patient in the patient's words. So different punctuation forms should be used by you. Use semicolons, use commas where necessary. Commas can be used in 4 different scenarios, and you can get a lecture on it from your grammar trainers. Semicolons also can be used effectively to combine 2 sentences which are closely related. Use apostrophe and full stops in capitalization. That's very important. So I see many common mistakes with capitalization, so please brush up your knowledge as it can impact your score if there are too many mistakes regarding these. Avoid spelling mistakes, and I know there are a variety of spellings as well. There can be a British variant and there's an American variant. In fact, I'm tempted to use both of these. A common example is memorize. It can be spelled with an S and a Z. So just stick to one notion. Don't try and mix American and British spellings in your letters. Just stick to one notion and use that. Avoid symbols or abbreviations. Something that I can add here is that given the audience or the recipient that you're writing to, abbreviations can be fine, but I'll give you an example to demonstrate the difference between a preferred sentence and something that might not score higher. So, for example, I've seen some doctors writing in this way. Her BP, and then in bracket they would write the reading like this, 120/80. Well, it's not wrong, but I think a correct or a more suitable sentence can be this. The patient's BP is or was, depending on when it was taken, 120/80. So the second sentence, the second example is more suitable compared to the first one. And you can see that I've used BP, I've used an acronym. I haven't written out complete blood pressure. So if your recipient is a health professional and you know that they would be able to understand an abbreviation or a medical symbol, then you can use those. Provided that it's a standard, it's used globally, abbreviations shouldn't be your own. It has to adhere to the global standards, and there is a list by Cambridge Medical, I think it's a Cambridge nursing book, which has a list of about 150 or 200 abbreviations. So you can just go through it once, and if the abbreviation that you're using is on that list, then it should be fine. But I would encourage you to go for acronyms rather than abbreviations. Then use legible handwriting. That means your handwriting should be clear. Cursive is fine, but it should be clearly read. Use a clear formal layout, and I know that there are a lot of confusions with regards to this as well. On the internet and even on the OET website, you will see many different layouts. There would be differences in where the address is written, the date is written, or even when it's signed off. Some people write yours truly, others write yours sincerely. Some websites encourage you to write your own name. Some suggest that you should just use your job title. So the explanation for this from the OET Center is that they acknowledge the fact that medical letters are written differently in different parts of the world. So they allow flexibility in this. As long as it's presentable and it looks like a formal letter, different layouts are allowed. So I hope you find this useful, and I know that the feedback that you get is according to the OET assessment criteria, but I'd like you to be mindful of these points that we just discussed and kind of self-evaluate yourself to see what your weaknesses are and work upon those.